Welcome to the show, everyone. I'm JJ Flazanes, your empowerment strategist and producer. Thank you for downloading today's episode. Today, we're going to talk about the pain paradox. This was a book written by Catherine Rolt, How Pain Can Lead to Inner Peace and Lightness of Being. Today's episode was very fun for me because Catherine got a chance to do a little homework on me and watch the interview Dr. Nasha did of me for the doctors. And so she knew we were on the same page before we got together. And in fact, I did a session with Catherine after this interview. I'll tell you a little bit more about my journey and what's kind of going on right now. But let's just say I've had not physical pain, not even emotional pain. It's more like life pain. And I really valued Catherine's words and advice and direction and validation of what was going on with me. And so she's written another book called Unravel Dis-Ease Naturally, Season by Season. And she's got a quiz, and we'll talk about it at the end of the show. And the quiz sort of outlines where you're out of balance in your life and based on seasons. She does 5-element Chinese medicine, and it's very fascinating. So I would highly recommend, if you feel at all called to reach out and have a session with Catherine, please do that because she is great. Catherine is an integrated Chinese medical consultant, practitioner, and a trauma and grief recovery specialist, offering compassion and help with all forms of physical and or emotional pain. She understands chronic ailments, not just on a professional level, but she too has personal experience of living with a lifetime of chronic illness, as she was born with a series of rare diseases. She believes that pain is merely a part of the experience of life and something that we are fully equipped to deal with. When pain is understood and treated at its roots and interconnected with the basic principles of nature, we are less overwhelmed and more empowered. And you can learn more about Catherine at unraveldiseasenaturally.com. There's a hyphen between dis and ease. Unraveldiseasenaturally.com, and you can find that link in the show notes. Catherine lives in England, I believe, and we did our session, of course, on Zoom. So she's available to do that. Also, I want to remind you that we're getting closer and closer to the Awaken Your Dream Life live event, where we're going to be doing a lot of exercises in person. And if you're someone who has talked with a lot of people one-on-one, and maybe you just haven't gotten that next level that you're looking for, consider joining us live in person. There's nothing more powerful, nothing more powerful than being around a group of people and doing some of this work together in person. So there are tickets left. Please get them as soon as you can. That way you can book everything. If you need a roommate or you want a roommate at the hotel, we can hook you up there too. Go to jjflazanes.com/dreamlife to learn more and get your ticket. I hope you enjoyed today's show. Welcome everyone to the show today. I'm so excited about this conversation. We're going to have a lot of fun. So if you are finding this on YouTube because you're looking for Catherine and you're interested in the pain paradox and her wonderful book, and you don't know me, I just want to let you know that I'm an empowerment strategist and a producer. So what that means, this is my show, and it means I'm going to talk. And if you don't like me, I don't care. So if you don't, I'm kidding. But I'm not going to perform for you. If you don't like me, that's totally cool. Where can we find more of just you, Catherine, if they just want to follow you?
Unraveldiseasenaturally.com, Facebook, LinkedIn. I'm around.
Okay, good. So unraveldiseasenaturally.com. Are you on YouTube? Are you on Instagram? Are you on Facebook?
Yes, and yes.
Okay, great. So look up Catherine Rolt, to find more of her if you don't like me. Okay, cool. Now we've got that established. For those of you listening to the podcast, we did do a video, obviously, because you just heard that. So come on over to jjflazanes.tv if you want to meet Catherine and watch this very fun conversation we're about to have, because it's going to be fun for many reasons, but for the reason that Catherine wondered how I found her. And as we were talking about before I hit record, and I said, she goes, is it serendipitous that you sent me this video of you and Dr. Nasha? I said, no, I found you through Dr. Nasha because I was watching her stories on Instagram and I saw your book and I was like, whoa, wait a minute. The pain paradox. I need to know about this book. So I looked you up, invited you on the show. And in the meantime, sent you the video of Dr. Nasha and I as just in case you would like to know about it. And not everybody listens and watches those, and they don't have to. But what a great way to start a conversation that we both know a little bit more about each other than some random meeting. So we can actually dive into a deeper conversation, because now, I know a couple things about about the book that you've written and the work that you do. So I'm not just some host who's like, has no idea about what you're talking about. Like, I work with what you're talking about, and I'm fascinated. And I love this book, The Pain Paradox. You have to get it if you're someone who has at all experienced any pain or still is. So I'll shut up now. Catherine, welcome to the show.
Thank you very, very much, JJ. I'm really excited to be with you. And I have 3 words for you, having listened very carefully. Emotion, emotion, emotion.
Right. Exactly. You and I are speaking the same language. So
Yep.
What's so interesting, I have this way of approaching guests with books now, even, ones I've read. I want to not read the whole thing before I meet you, because I don't want to start from the place of I've already read it. Now let's continue the conversation, because my audience hasn't. And I want them to read the book, and I want them to get the book. So as I was going through it, trying not to read at all, like looking through the different seasons and the different organs and being like, oh my God, I can't wait to talk. I thought, how interesting. I have been doing acupuncture for 22 years, and I had a session Monday. It is now Wednesday. So 2 days ago. And we were talking about cancer. We were talking about a bunch of things, but anyway, what I said to him that I've never said before, and I hope this doesn't offend anybody. I hope you really understand me and hear me and feel me when I say this. I was telling my fibroid story about my experience with Western medicine and intuition and all the different treatments and alternative medicine and Chinese medicine. And one of the physicians had said to me, because they all wanted me to do surgery, she said, well, at least it's not cancer. And I said back then, and I said to my acupuncturist, I said, look, I'm not inviting in cancer, but I have to be honest, cancer doesn't scare me. Number one, because of how many tools we have for it. And number two, because if I attract cancer, it means I'm really out of balance. And that's a message for me to wake up to. So I'll take the message and do the change necessary. So it's not like I'm saying, oh, I'm above cancer. I'm just saying it's not. And so when I'm reading your book and you're talking about living with pain and the pain paradox of that, inviting it in to make you better as a person, it's not a, oh my God, it's such a problem, let me hurry up and make sure that it goes away and numb it. So let's go back to the beginning. Let's talk a little bit about, those of you that are on the podcast have heard her bio, but those of you watching on YouTube or listening on YouTube have not. So Catherine, let's go through your story about your own personal health and then into what you're doing and then writing this book.
Okay. So very, very briefly, I was born with a matrix of challenges medically. And I was almost completely deaf for the first 7 years of my life, which interestingly later on became an incredible gift, because I'd learned to listen internally and deeply. So before I give my power away to anybody else on the outside, I will check inside. So you will definitely know what I mean by that, JJ. So I went literally in the space of 2 hours. I went into surgery when I was 7 years old, not really hearing at all. And coming out, suddenly noise was new to me, noise of all sorts. And that was the beginning of a very, very long journey where only, I'm 61 years old. I can't quite believe I've got this far, but I was only diagnosed properly 15 years ago with a collagen disorder, which affects A through to Z. And the first thing it put down were my ears. And as a result of this, I've had to have 39 mostly spinal surgeries, and I've had a stroke, and I've had 3 brushes with cancer. So very much like you, I am, and I never mean to offend people, and I definitely am not prepared to get competitive with diseases or anything like that. But cancer is, when you've had a 20-hour surgical procedure and a stroke, and you're told you have cancer, That made complete sense to me. So I wasn't frightened at all. In fact, I called it my love lump. And it was a parcel that was just holding vast levels of toxicity, and I needed to thank it and listen to it. So the reason why the pain paradox has come about is because I've got 44 years of clinical experience as a practitioner and of integrated Taoism and Chinese medicine. And I have also been a patient. And I think I have become very frustrated and saddened by the amount of suffering that is going on out there, where people are totally separated from how amazing they are and how many tools we have. And there is absolutely, I really believe that we do have to get alongside pain, but I don't believe we have to suffer as much as we do. And I think I'm just going to end with this. You know, most of us that drive our cars, even the modern cars, we know that when there's a flashing light that says we haven't got enough petrol, we must go to the petrol station or the diesel if you're in the States. But we're getting all these flashing lights in our own bodies, and we're taught to fudge it, ignore it, deny it, or get hysterical about it, personalize it, dramatize it. Oh, excuse me, you don't do that when you've got a bleeping thing in the car. You don't fudge it, deny it. Do you know what I mean? You just go, oh, I need to get some more fuel for the tank. Basta, full stop. So the pain paradox has come about with the intention to just really help people understand how much simpler things are. Not necessarily easy. They take courage. You have to be really ballsy. I hope I don't offend anyone by saying that. And you have to be willing to get to know yourself layer by layer by layer. And you have to discover that shame is going to keep you locked up. And most of us come from generations worth of energetic, clogged up shame. And various things mean various things that then build an energy field that just drown us. And there are people out there like you, JJ, who just go, listen, if you want to leg up, come on, get up. But I'm not coming down with you.
Yeah, that's the bottom line. And when it comes to my show, you are not offending anybody. I mean, please, if you could, I push. I am a hard sell when it comes to the show. When I'm one-on-one in person, I'm not as hard. It's more of a, and I'm only using hard because of somehow people interpret it. But people who know me, who've been listening for a while, who are connected, feel the love I have, feel the passion I have, feel the dedication I have for them to come out of suffering, for them to make change. One of my clients had never been to one of my live events. She would show up every month in our group calls crying. She had a therapist. She is a therapist. And I was like, she said, can I get a virtual ticket to your next live event? And I said, no, no, because it won't change you. You have to get out of your comfort zone and get on a plane and get here and do the work. And that's the only way we're going to shift some of the stuff that you're dealing with, because you just keep repeating these patterns. And so I'm a pretty hard sell, but it again, at the end of the day, it's always about your progress, your change, because that's why I'm on this journey. And and people see me grow every year. I say, raise your hand if you've seen me change in the last year. And it's always everybody, because I'm walking the talk. I'm not just telling you to do something I'm not doing. I'm in fact sharing with you what really works for me, so that you have something to do and a light in the tunnel and some hope. And, coming from the personal training world and been doing Chinese medicine forever, my favorite of all things, all the time, herbs, Chinese medicine. Yeah. When I was first taught, and I was thinking about this when I was reading your book yesterday, it was probably one of, I'll shout out to Shahid. He doesn't listen to my show, but shout out to Shahid, one of my many acupuncturists early on, who was the first person to draw me the circle of emotion, if you will, like a diagram to say in here, like the heart and joy, the spleen and worry, the liver and anger, the lungs and grief, and to sort of make that like we're cycling through these all day long. And the problem only becomes when energy pulls in one area and gets stuck there and gets stagnant. That's what causes the imbalance. But when he linked the organs to the emotions, I was like, wow. And I was a personal trainer at the time, doing emotion on the side, but not really claiming it, not really giving anybody tools because nobody cared, because they were just wanting to lose weight and exercise and eat differently. But again, I take an observer perspective in life most of the time, and I look for patterns. I look for patterns. I look for things that, things that repeat themselves, and behaviors and ideas and personality types and astrology types. And these patterns help me to go, oh yeah, okay, I see that happening. And then it gives me answers. And it's not, and then of course the education from reading the books and using the tools and learning from people like you, that's what I put in my toolbox when I approach people with this information. And even still to this day, I mean, working with a lot of Dr. Nisha's doctors, and I've had to work with a lot of cancer patients to get back to the reason why in her terrain 10, it's 10 is because it's a whole world in itself that she's not going to go into. But to me, it's still the most important one. It's still the most important one, because in quantum physics, if the container that you're doing all this work in is not in alignment with who you are, if you're not in a place of peace and groundedness, if you're not in a trusting surrender and allowing state, all of these doing protocol efforts will be like trying to pull something up a hill. It's not and while they may work, it won't be long lasting, because you haven't really got, like, the body's designed to heal itself to a certain degree. Yes, there's environmental factors and things that we're going to talk about, but the pain paradox in terms of your idea and of living with it, of it, looking at it differently. It's like I teach law of attraction. So contrast, like looking at something as not as a problem, but as an opportunity, always to fine tune, to redefine, to reach new levels, to get better, to sharpen the sword. And that's exactly what you're talking about. But I hadn't really. Pain's an indicator. Disease is an indicator. Off balance, it's an indicator of being off balance and being out of alignment. But the way that you put it at the beginning of the book, explaining your story, really took it to another level for me of people embracing their pain. Yeah. There's an embracing of your pain to say, this is here to serve me. That's another gentle shift energetically for people to not just be so darn afraid and wanting to numb and wanting to fix, but to listen, like you said, very deeply listen and go inside, versus the first thing we do is pop pills or go get it taken care of or eat too much or numb ourselves. And that's not really what this is about. So I was pleased at the way that your book is set up. And why don't you explain to people? So you've been a consultant and an integrative Chinese medicine for how long?
This is a slight joke. But my mother this is true. My mother used to pick me up from stations when my parents got divorced. And the first thing she'd ever say to me is, and who have you been working with today? No matter how young I was. So I think I came in as a practitioner. And at a very early age, I started being called a healer. And I was very timid and sort of passive and quite frightened. But it was quite funny, because when somebody would say that to me, I was absolutely adamant. And I wasn't frightened at all to say, no, I'm not. And I remember prayer as being a very important part of my life. I don't consider myself religious, but I really believe in the power of prayer. And I remember just praying and saying, why am I so adamant that I don't want to be called a healer? And I got the answer. And it remains true today for me. I think there are people who do come in as healers, but I think that I've come in as a sort of signpost or as a catalyst. And if people think that I'm the healer, then they are never going to know that they have the healing within them, and they can access it through what I call the universal love and the universal. The reason why I definitely don't, in a way, I don't want to be associated with, I don't want my faith associated with religions, because my faith is about hope and about love and about something that is far greater than ourselves. And I don't think we can be so arrogant as to define it and say it's this or it's that. I think individually we have a sacred journey, and we need to own that sacred journey without feeling as if we're somehow letting someone down, or an organization. I mean, the church is all of us, whether we're black, blue, poor, rich, Buddhists, communists. It doesn't, what is in our hearts, because a body health, no matter what you're challenged with, real health actually is how you behave. I love that notion that, I can be coming out of these surgeries that keep me alive, and I'm a complete wreck, okay, on one level, but I'm also the wellest that I've ever been in my entire life, because I still can behave properly. And that cycle that we go through, if you and I were wandering around India, England, America, and we had 5 different people just needing briefly to share the reality of that moment they were in, if we're really healthy, we will be sympathetic one moment, and then we will have a belly aching laugh the next moment, and then we will be sad, and then we will be righteously angry, and then we will go, oh, that's terrifying. And then those people that we've been with will feel validated. That's real health. And that's what we have to learn to give to each other. Practitioners, more than anybody else, we need to learn to be emotionally available. Emotion. Somebody says to me, somebody said yesterday, they said, how do you manage to shift people's energy? And I said, well, I'm with them. And they went, well, what do you mean you're with them? And I said, well, if they in our membership, very sadly, one of our members' brother has killed himself, I'm not going to laugh with her. I'm not going to be angry with her. I'm not going to be frightened with her. I'm going to be sad. She needs to see me being healthy enough to go, so that she can feel safe. We're not good at allowing each other to be safe with each other, and we're all vulnerable. I'll ring you in 2 weeks' time, let's say, and say, JJ, whoa, that's the process of life. That's the humility that that's what makes it so, however challenged we are, that's the fun, to live humbly in the center of that emotional wheel, healthily.
That's the illustration, or the explanation of the illustration that I talked about, right? The way that it was written out for me, that he did, was to show, and he literally made an arrow from each one to each one. And it was all the organs and all the emotions, and the idea that chi is going to flow through all of them. So you're going to cycle through all the emotions several times a day, every week, every month, whatever. But it's not a problem. Like, it's not a problem to have anger. It's not a problem to have fear. It's not a problem to have worry. It's when it's out of balance. It's when it's the dominant. It's when chi gets stuck there. So when you just talked about that story about like listening to a person's story and experiencing all the emotions, that, I remember working with someone once who described it as, it's like air. It comes in, it comes out. It comes in, it comes out. It's not to be repressed. It's not to, also, we have triggers of leaning down into something that allowed to suck us down. Like, we can't get our bearings because we've trained ourselves to be taken over and dominated by, let's say, a sadness, and we'll call it depression. But depression isn't necessarily because you have something chemically going different in your brain. Depression could be a trained response to, for some people, get what they want, or to get attention, or to get their needs met, or to avoid something, because then they can use, and again, this is all subconscious. This isn't necessarily conscious. No one decides they want to feel bad. consciously. It just happens to be what ends up getting worked out. But that the way you describe that story, again, still is like the living illustration of the picture that I have in my mind of what he drew for me in Chinese medicine, of Chinese medicine's relationship to emotions.
Yeah.
And it's funny because then I had once years later, I had one of my acupuncturists, and I would go to, like, I've worked with individual people. And at one time I worked a lot with people at the clinic. So I'd use some of the practitioners going through to get their degrees and to get their license. And there would be the teacher would oversee some of those. But then one of the teachers was really specifically good with physical stuff, like any kind of pains, back pain, whatever. And I remember I had just lost a kitten. I forget what I was coming in for, and old school Chinese guy though. And he asked me something and I started to cry, and he goes, "You cry? You have depression." I said, "No, I don't have depression. I'm sad because of my cat." And I'm sitting there and after he had left and like the intern came in, I said, if I did not know better, I would walk out of here mad that he just basically, or I would think he was right, which I don't. I'm like, I don't have depression because I cried. I cried because I'm sad because my cat just died. Like, and the intern, American girl who knew, she's like, yeah. The old school Chinese people, we don't deal with them. Like they're old school. I'm like, but this is Chinese medicine. Like, this is good. I'm letting out chi. I'm now circulating better because I've released this sadness. Why am I not being praised for releasing my pent up frustrations or sadness? Instead, I'm being judged and telling me I have depression. So anyway, it's hilarious. I knew better, but I love how you described that, because that's exactly how it was told to me initially. Wasn't by this guy, but at least I knew better to not. I looked at him. I said, "No, I don't have depression. Don't tell me I have depression. I'm sad because my cat died." But this guy had no emotion. He stuffed his stuff down. So I'm kidding. He had his emotion, but you know what I mean. So when we look at this, how do I be like that? When you were saying that, I thought, and you said we have to learn to be empathetic. We have to learn to be with people. And I'm sure you work with this too all the time. I see it a lot in couples. I see it in all relationships, but definitely parents and couples and definitely with men, because what happens is the reason why they can't receive someone else's emotions is because it triggers theirs. It's theirs is so locked down that if you cry, it resonates with the part of me that wants to cry that I don't want to experience. So I'm going to tell you to stop crying. I'm going to shush you. I'm going to be like, okay, it's okay. Just okay. You don't have to cry, because of how it makes me uncomfortable. I think the reason why we don't know how to be there for people is because we're not comfortable enough in our own pain. Would you agree with that?
Yeah, totally. I mean, I haven't done it yet, but I really am going to do it. I really want to train people and teach people how to listen, how to hear and how to listen. Because one of the biggest, I really honestly believe this, wherever I go, I witness it. Nobody knows how to listen and hear each other. So you've got this sort of, it's like a dreadful ping pong game where nothing's landing, and energetically it's almost like it's kind of like a storm which is constantly being kicked up, and nothing is being resolved. I mean, I at the moment I'm not doing it, but I used to work a lot with couples, and I used to sort of, because my whole training is get down to the root. What is the root? What's the priority root? Because if you get the roots wrong, you're just adding more muddle. And I used to really get hold of people and go, listen, we're going to begin at the beginning. Neither of you listening or hearing. Neither of you. So, this can't be successful. You're wasting your money. You're wasting my time.
So are people coming to you? Because I'm really curious about this, because you've written this book and I'm like you, but most people doing Chinese medicine are not like you. So let's talk about how that came to be, at what point that you entered into this conversation to deal with these emotions in the way that you do. And then of course, write this book.
Okay, well, I'll tell you a really honest, funny story. I'm one of my superpowers is that given half a chance, I'm just ruthlessly honest, really, because I think that really it certainly helps me, and I think it frees everyone else. And I can't bear this idea that, because we've written a book or we're on a podcast, that we've arrived. Folks, come to us. It's just nonsense. So I just love being real. And I think I'd already been qualified. So my training took 9 years. And I was so gagging to work with people that I shot off like a rocket. And I just loved it. I was passionate about clinical work. And I had waiting lists, and I had a reputation, and I was sort of off, really. And then I can't remember how the hell it happened, but I ended up doing a training that was completely outside Chinese medicine, because very early on I decided that I'd spend the rest of my life learning this huge subject. Because once you peel back Taoism and Ayurvedic medicine and shamanism, there's never going to come a point when you can arrive and say, I've learned that, I know that. So having made the commitment that I wouldn't go outside of it, I felt really strongly led to do something called a grief recovery training. And there I discovered that I didn't really know how to hear, and I really didn't know how to listen. And I was constantly in what I call fix-it energy, which is not really very helpful at all. So there was this marvelous point in one of my clinics one day when I caught myself going, I was sort of doing my usual spiel, and I caught myself in what I call fix-it energy. And I realized, I looked at this darling person's face on the treatment couch, and I realized that I actually hadn't, with all the skills I had, I absolutely hadn't heard what they were saying, because I was so busy sort of performing as a sort of, a practitioner who kind of knew what to do. I'd already decided what I was going to do. I'd worked the notes before, and I really like this about myself. I just stopped completely. And this lovely person said to me, "What's going on?" And I said, I have an apology to make to you. I really am sorry. I haven't heard you. We're starting again. I'm going to carry on until we have shifted this. And I really, really apologize. And from then on, and I'm still practicing it, and I'm still making mistakes. But I realized that by listening and hearing myself and another person, then I can energetically help people shift into the next layer. And I really laughed with huge admiration listening to you earlier today and yesterday, because, I think our emotions are such a key to, I diagnose through people's behaviors, but I don't diagnose with judgment and shame. I diagnose with, ouch, that really hurts. That's as bad as walking around with a broken leg, but you've got a broken heart. Or, there was a time in my life over 3 years when I lost 13 key people in my life. 13.
Wow.
And I was wandering around going, I really wish I was in Beirut or somewhere where people understood what it's like to lose so many people, because people are coming out to me and saying, "What are you doing this weekend? Have you seen the latest fashion?" And I was going, no, I don't. It's a weekend. I don't, but there was like this. And because of the grief recovery, I actually could go to people who would just stop and listen and help me recover. And it was possible to recover. I'm not stuck there. I've had deaths since. I work with members in our group who have a lot of death going on. I work with people who are dying. If I was stuck, I wouldn't be able to do it. So to be emotionally healthy, the first key for me is learn to listen. We have to listen to ourselves, and we have to then hear. You can't separate the two. They mean something slightly different.
So I'm going to go back in that you were working with someone, you were doing traditional Chinese medicine.
Yep.
Then you went to the grief recovery and learned that you weren't listening, caught yourself in your fix it. Definitely, I am guilty of that. I am better. And I think as time has gone on, I have gotten better. But one of the things that my trainer said in my very first group of certified trainers that I had, one of the things that a lot of them are very, we all have good information, and people want to be, we're addicted to the rescuer. Yeah. Right. We're all addicted rescuers. So what that means is we aren't listening. We're just getting ready to talk, and we're thinking about what we're going to tell you to do before you're even done finishing your sentence. And I said, no, hold on. Like, so they would want to get more prepared in the front. I'm like, no, just listen to what they have to say. Someone coming to the table, don't think you already know the answer before you've had the conversation with the client about what it is that they want and what they're willing to do. This is a co-creation. This isn't just, you're going to tell them what to do. You don't even know if they're going to do what you want to do, or if they're willing to do it, or if it's in alignment with what they think. So you have to, I did get the feedback that it taught them to be better listeners, which was better, but I've had to get here. A lot of it was my own shame of having information, but not having a degree to back it up. So feeling like, let me prove myself to you. It was my own self-worth issues that I'm not feeling important. I wasn't feeling heard. I definitely didn't feel reflected back to in my life by anybody in my life. So I'm searching desperately to find that, like, I think this is who I am, but none of you are reflecting it back to me. So it's in the search of finding my own self and self-worth and confidence, and just who am I? And like, I think this is who I am, but I can't. So like looking for that alignment, looking for that mirror. I had a therapist once tell me, you have not yet had your reflection. Like, you haven't found the person to mirror you back, to show like who's there with you. And so you going back to your experience, learning, going to the grief recovery, learning you didn't listen, coming back, noticing your fix-it energy. Prior to the grief recovery, did you do emotional work with people?
Okay, so my original training was in 5-element acupuncture. So, which is you diagnose through color, sound, odor, and emotion. So we were absolutely taught how important our emotions are. So, and I think that was one of the things that really attracted me to the training. I mean, the interesting thing was that I had left school at 12. I was put into hospital, and I never returned. So I, maybe in a similar way to you for maybe different reasons, but I was constantly feeling inadequate. And I used to kind of make a joke about it, how uneducated I am. And so if it was today, I probably would have had to do about 17 years worth of training before I got anywhere near. I mean, I would have had to go back to school to get all the original documentation in order to. So I think it was when I was given this extraordinary opportunity to be trained, it was so close to what, I mean, I was brought up on a farm, and, real farmers pick up the energy of not just the seasons, but their animals and, each other. And and they're not in their heads. I think our educational system in the West has cut people off from themselves. I mean, a lot of the work that I end up doing with people is I teach them to get back in their bodies. I teach them that they have completely delayed emotional reactions. No wonder they're so unhappy. They're just sort of stuck, suspended, and of course not very happy.
No, that's super important. Absolutely. I mean, it definitely, I was told that like I had like some people that would say, oh, you're too in your head. And then there was this, then I'd sit with that. And there were times that that was true. And then there were times I was like, no, no, it's not true that I'm in my head. Absolutely. But I'm extremely connected to my body. And so I'd had to kind of vacillate between that, but I can see where the times that I was, and I would say, okay, true. Yes, I'm completely in my head right now. I'm disconnected. Then I would see it in others also. And part of, I'm sure, the work you're doing regularly, like you said, is to get people into their bodies. And it is for me, like, again, kind of go back to like the live event. I don't have to have live events, but I need to do them because it's where the real work happens. It's when people have the change because of being in their bodies, being away from the computer, being out of their routine, being out of their environment, experiencing life new as like, right. So, and so to me, that is a huge part of the work, because we're currently on a podcast where people are listening with their ears and thinking with their brain, but it's only going to go that far if you don't take any further action to integrate it into your cells. So you're just going to hear it and you're going to learn it. So when you started working with emotions, and that's how the book is set up. The book is set up by the 5 elements and the emotions and the different parts of the body and the organs associated with that season, with those elements. And then so for those of you that know, I use the messages from the body book. This is like Chinese medicine messages from the body book. It's looking at what are the indicators and then the seasons. And it's a beautifully organized in this way. And I went direct to large intestine and small intestines because I've been having some like lymphatic challenges. And again, by the average, I don't have any symptoms that would give any doctor a red flag. What I have is knowing that things are not moving the way they should be and that there's something blocking it. And so lymphatic has come up as a new thing for me. So I'm looking in large intestines and I have like I can't tell if it's twisted or if there's something there. And I'm like, oh, is it? So I'm looking at them, looking at myself thinking, is it that? It's more probably large intestine than it is small. When I read those didn't resonate. But it's a fun book to use, not to diagnose, but to look and to understand, hey, these are things. And I don't know if that's where you intended it to be. I'm guessing because that's why you put it out. This is the work you do. And you're showing people kind of how to do it, not for themselves, like they're going to be the cure all, but hey, it'll help more people if I show you how to look at this differently and to assess, and then to look at your own body. Am I accurate in that? That's why you wrote this book. It's like, okay, this is the work I do with people individually. But now I'm going to write in a book so that everybody in the world can have it and you can start helping yourself. And then I'll still be here if you want my help, but I can't help everybody. So maybe you can help yourselves.
And the other thing, JJ, which I think you'll really enjoy is the opposite of pain in the way that I was trained is potential. So, it's like, I can't help it now that you've said your large intestine, small intestine, lymphatics. I'm kind of going, wow, how exciting. What level of potential, the next level of potential is coming out in JJ. And it's like, I kind of want to forget the podcast and go, yes, okay, come on, let's roll off our sleeves and find out. Because, the language is there. And I think that maybe, I obviously don't know you too well, but we're both interpreters and translators, and that's one of I think the best jobs in the world, and so people can give me all this stuff, and I go, is that the only problem? And they go, you want more? And I go, yes, come on, give all of it, because chronically ill people, and we've got 44% in America and 38% here, and that's chronically ill plus 4 carers or people involved. So that's a lot of people in pain. And Western medicine, which can be helpful, is collapsing at the seams. Private, public medicine, complete mess. It's very drug orientated. It's fix it energy. And no one has any idea that all this potential is stuck. And there are people, thank goodness, like you and I, who are going, hold on a minute, what's going on? You're up to something. There isn't anything wrong, except that you don't know how to translate it. So, yeah, I thought that I would put out a book and do various other things to go, hey guys, wake up. If I can still be here, for goodness sake, then there's lots of hope. And I think we're living in a world now where hope is being squeezed out and people aren't responding to climate change. How can they? They're not responding to themselves. So the climate is just it's like, what does it mean? Doesn't mean anything. It's like me saying to someone who's never felt sad in their life, excuse me, you're stuck in grief. And they go, no, I'm not. Okay, right, okay. Do you want to get rid of those symptoms? Yeah, I do. Okay, we're going to start showing you that you need to feel some sadness.
I have done this naturally. Nobody else has taught me this, what you're talking about right now. And again, it's that interpreting of going back to the wheel with Shahid and hear all the emotions and then you go through them all the time. So my partner has, he doesn't have, I don't think he has access to his anger. And I'm like, you gotta get angry. Because it's in you, it's there. And he's had some back pain over the years, not really recently. And there's other reasons for that, but he's definitely have situations where I know that somewhere in you is anger. His mother, who I love dearly, she's 89, and her older son had died a couple of years ago when I was there. And I remember, and it's helped to stimulate my next book, which is about the work I'm doing right now. But I said to her, and I kind of coined this phrase. I've never heard anyone else say this phrase. So correct me if I'm wrong, if you've heard this before, but so her name's Rosalie, and we were at the funeral and on the way to the funeral, and I looked at her and I said, Rosalie, have you cried yet? And she said, no. She's like, that's a problem, huh? I said, I think you're emotionally constipated. And so that has become my phrase of like, you're emotionally constipated, because it's the truth. And we all have, if you never experience any of these things, and it's always a nice person, right? It's a really super people pleasing, nice person with the back pain and the chronic such and such. And it's anger. Oh, I can't be angry. Yeah. Well, you need to learn how to be angry, because it's literally like what you need to do to get out of whatever you're in. It's these societal and religious and parental expectations of how someone should behave that don't allow for your humanness. And we forget that and we judge it and we're afraid of it. In fact, I did a solo episode called Anger and Spirituality, because we have this whole idea of like, oh, spiritual means that I'm always on lockdown. It's like, okay, no, I have one of my friends he was the first person to teach me about Dr. John Sarno, because Indian guy, meditated his whole life, Gemini, gay, was not out to his parents. This is before he came out, and had back pain so bad. And he was going to have surgery. And then he read the book and he's like, this isn't in my head. And then finally on the way to surgery, read it again or something. He didn't do the surgery, but he finally read the book, and then actually at the time saw Dr. John Sarno a few times, and then his pain was gone and his back became his indicator of being out of balance or of telling him he needed to process something. But he never had the surgery, and he had debilitate. And he kept saying, no, I have a pinched nerve. Look at my MRI. I have a pinched nerve. I'm like, I don't care if you have a pinched nerve. This is, and but he did at the end teach me. So it's like, oh, what is this back pain about? Repressed anger, about not being allowed to be who he is. And so his back pain relief came before he came out as an adult, but it was identifying that what was that really about for him. And so many of us, like you said, and maybe I shouldn't claim the fix it energy so fast. I definitely, because what you're talking about in Western medicine is fix the condition, fix the problem you have right red hot now, not look at why did it happen in the first place. I've been saying that as a personal trainer for years, people that do knee surgeries. I'm like, did you work on your ankle or your hip? Because your knee's a resultant to your ankle and your hip. And if you don't fix what's going on between your ankle and your hip, you're going to have the knee thing again. The knee doesn't do anything. The knee is only directed by the ball joint above and below it. It has no choice. So if this is a structural thing, okay. So again, I've been root cause oriented from the beginning, but using the body first, and then now using emotions, and now disease. Oh my God, disease. But when you work with cancer patients who won't listen to you because you don't know, you haven't been through cancer. Okay. But I can't tell them I've made a meme that I've posted a couple of times. I post it like sparingly, but it says, if you only knew the power of your emotions, you'd work on nothing else.
Yeah. Absolutely.
Just like literally, I know the scans and the this and the that. I'm like, surrender for a minute. Like we have to remember who we are as humans and stop the doing and be in the being. You guys, we all like suck at being. We don't get cancer because you're good at being. You get cancer because you're good at doing. And that disconnection, any disease, right? And then there's the environmental things. I know there's physical things. I'm not denying that. But I think at the end of the day, we don't allow our bodies to heal because we don't know how to be in our bodies. We don't know how to deal with emotion. We don't know how to cry for somebody. We don't know how to get mad.
Yeah. And I mean, JJ, you said in your, I wrote some notes when you were doing the interview with Nasha, and you gave a fantastic example of the people who, I'm very dyslexic. Let me see if I can get this right the way around. So you gave this example of people that have seemingly nothing wrong, nutritionally, structurally, maybe all the tests, and yet they are in agony. And then you have, I'm going to give the example of me, but I see this, and so do you probably, all over the world, magnified. I have more metalwork than is in most cars, and it's a great privilege and honor to have that metalwork. That's what keeps me here. Well, every single time I see a consultant, they say, listen, we've been looking through your notes and that we can't find your pain medication. We know you live with pain, so what are you on? And I go, I'm not. And they go, but what, and then they begin to get quite cross. They're not interested. They just get cross because I'm out of their paradigm. So, and then I can't help myself. I always ask them how they are at that point, because that really fuses them completely, which is very naughty of me. But anyway, so, and they go, what do you do then? And I go, well, hot water bottle is very effective. I find out what's really bothering me. And the pain helps me not behave like a lunatic and join how much arrogance is out there. Yes, of course, I'd like to be doing all the things I used to do, but I'm alive. I woke up this morning and so did you, JJ. That's a hell of a beginning.
For those that haven't read your book yet, and they're going to get it, The Pain Paradox, because there's someone in pain, and it might be you. Can you just go through the list, the laundry list? All the things that you live with and have gone through, just because not for like an ego, because they don't know yet.
Okay, so to be fair, this is how I'm going to list it. One of the reasons why the consultants are so blown by me is because I don't walk in as a normal patient. I'm not doing this podcast kind of going, oh, do you know, I've got all these things wrong with me. I'm so attached to my story. So I was born with a collagen disorder. I have one of the rarer forms of the rare thing called Ehlers-Danlos. They're all completely, almost, you can hardly say these things. I have got postural orthostatic tachycardia syndrome, which basically means that my heart rate and blood pressure is never equal. I have mast cell activation disorder and a whole lot of other things. So basically on a structural, physical, chemical level, all my systems are constantly, almost every minute of every day, trying to find equilibrium, which on the one hand is a nightmare. So I'm never symptom free. On the other hand, it has given me the most extraordinary voyage of opportunity, because I have to pay attention to myself. I can't do this podcast if I'm arrogant enough to kind of walk ahead into the podcast and leave myself behind. I have to be present. So there's lots of teaching out there about meditation or being present or being in the now, and the gift that being a little bit compromised gives you is that you just have to practice this stuff, and it has to become like second nature. And then it becomes much easier to work with other people and go, there are choices. There are many, many more choices than you've been given right now. So I'm constantly working with people that have been told they've got 3 months to live, 6 months to live, and most of them are still alive.
So someone's listening to this and they want to buy your book. It's out, right?
Yep.
Okay. Well, I think you were right before possibly when Nisha put it on her story. I don't know. So The Pain Paradox, Catherine Rolt. Talk about how because I was looking at that you still help people, and do you do it telemedicine, like through Zoom and things? Can you help people who?
Yeah. So okay. I see people in London, and then I see people on Zoom all over the world. And then we have a membership for chronically ill people. And one day you and I better get together, because I'm determined to start doing memberships for men, because I think they're in such trouble. So, but one thing at a time.
One thing at a time. Well, yeah. And then you got to find the ones that want to do it, right? There's the do they need it? Yes. Do they want it? No, they don't want it. No, it's the dance I do between talking about emotion, and people are, I talk about it ad nauseum, and emotion. And the guys, even like past clients of mine that were personal training clients, emotion, literally they shut down. Like emotion, you hear that word, boom, they shut down. But if you say stress, oh, I'm stressed, I'll claim that word. Oh yeah, I live with stress. I'm like, what the F do you think stress is? It's emotion. It's an interpretation of a situation that you don't like. So it's what's underneath the stress is emotion. That's what it is. Why is this hard to digest? But it is because of what they think that means. Oh, I can't admit that I have emotions. It means I'm weak. It means I'm whatever. I don't, all these layers. I'm like, just like you with the gaslight in the car. It's a great example. Would you yell at the car and negotiate about why the car? No, you just go to the gas station and get gas, because you knew that if you push it any further, the car is going to break down. There will be consequences. Same thing in the body. That I would say that to my dad. My dad is meticulous about his things. And I'm always preventative. I brought them to my functional medicine doctor and nutritionist, and had all the blood work done, and had these conversations. And Dr. Allen says to me, this is 2017. He says, JJ, your parents are healthy. I said, right. And I want them to stay that way. I'm like, I'm getting out ahead of this. This is why we're here right now. Don't tell them that, because they won't act if you tell them that they're healthy. They'll be like, good, I just keep doing what I'm doing. No. You need to scare them into like doing better so they stay good, because that won't translate to them. That's the mentality.
Okay, JJ, I'm coming back as your child next lifetime. You might entice me to come back. God.
I don't want you to get in the queue right now, but please stay. It's possible, but stay. Well, I just think I don't know. It's just how I'm built. And I'm just curious, and I'm not looking for an age or anything. I'm just curious about your astrological sign in Western astrology. What's your birthday?
Aquarius.
Oh.
February 15th.
Oh, I love it. Okay. I'm a Pisces, but I have a lot of Sag. And what I love about and I have Aquarius, my Mars is an Aquarius and my Mercury is an Aquarius. So that's the chatty, can talk for a long time.
Okay,
Mercury.
well, you and I could chew the fat for years.
Well, and you're like, oh, I'm direct. I'm like, I'm direct. That's why I have to do this disclaimer when I put this stuff on YouTube, because I'm like, oh, someone's gonna not like me and have to tell me about it, which is fine. I don't care, but like, don't waste your time. Don't waste your time typing, because I'm gonna delete it anyway. Because I don't care. Like, I'm not here to please people. I'm here to help. I'm here to help you. If you want the help, if you don't want the help, move on. And that's what people know about me. Like, don't waste my time. I can like be doing something fun and not helping you, unless you want the help. I'm happy to help. So I want people to get your book. Do you want them to get it on like another site other than yours, or do you want them to buy it on your site?
Amazon is the quickest way to do it.
Okay.
So it's there. And then there's a seasonal quiz, because I really want people to begin to know I really want people to begin to identify where their energy is stuck, because most people, if you ask them, if you actually say to them, and they want to be honest, if you say, listen, which is the emotion that you're the most frightened of? You know, anger, sadness. You know, do you know for a fact that your lack of joy, you know, are you good at being sympathetic? Because the interesting thing about the spleen in the stomach is it's like the late harvest. You know, I mean, it's harvest time. So is our internal stores so abundant that we can share our abundance with other people? And if you look around, a lot of people, they have a complete lack of sympathy and empathy because they're not abundant inside. They're late, the kind of late summer, the harvest hasn't arrived. So I really wanted the book to connect people to the seasons and the organs, the emotions, the behaviors. So there's a little tiny quiz and people can begin to, it's just a free resource. They can begin to sort of have some fun. And
I saw it.
Judging other people.
I saw it in the book, but I didn't go to the site yet to do it. And I plan on doing it because I want to know. Oh my gosh. Anytime anyone comes to me and says, have you heard of this? Like, let's say my friend Lisa, she clears inherited emotional DNA. And I interviewed her and I was like, who wouldn't want that? So I'm always like, some new thing I haven't tried. Yeah, I'll try it. I've never had that before. Why wouldn't I want to try it? I want to know what that is. Why do I? So I want to know. I've never been tested on that. And I think that's fascinating. And I do want to dig into a little bit about what's going on with me in the moment and look at
JJ, bring me. I'll work with you happily. It's such fun working with people. I really like people. No, it's so funny. Throughout my life, people have said to me, oh, isn't it exhausting working with people? All those people, all their problems. They're sort of just like this, terrifying. And I go, no, never. It must be so exhausting. You're such a lovely person. And I go, no, I'm not always lovely. And it's not exhausting. It's very energizing.
Right. Well, that Aquarius big picture thinker. So I have that, right? Because you're above it. You're not in it. Even though you can be empathetic, you're not in it. You're looking at it. You're assessing it. You're interpreting it. And it's data. I mean, that's what I used to say when the first person said to me, you need to do a certification to train people to do what you do. And I was like, I can't teach people to think like me. It's how my brain works. I can't teach that. And then, but then I thought, well, but I can teach the tools. Okay. Which I'm doing now. I'm like, okay, I can teach the tools.
Absolutely delicious. Oh my God.
Right. Well, because it's how you look at the world. It's how you, like, I could take things. I had to learn that the hard way. Do you know the work of Dr. Marshall Rosenberg, nonviolent communication?
Yes.
Okay.
Yes.
I can't tell how many classes. I would bring people to the class, my people, okay, family, friends, clients, people that I knew. And I learned how I learn. And I didn't know this. I go to a class and what happens, it's automatic. If there is something in an order that doesn't make sense to me, I rearrange it to make it make sense. And I go, oh my God, that's amazing. And then it's only when I put it down in front of other people who are taking it as it's being given and are thoroughly confused. And I'm like, why is everybody not seeing this? And I went, oh, because you didn't rearrange it like I rearranged it. Let me rearrange it for you so that you get it. And I'm like, oh, that's what I mean. Like, I can't teach that because I just move it around until it makes sense. I make these connections that people might go, I don't know how you got there. I'm like, oh, because this, and I take and I move around like I'm working in a, like it's Jenga or it's the Rubik's Cube, or I'm like making a recipe and I'm taking a little bit of this, and a little bit of that, and it's making this thing. And that's what I do. And I can't teach that, but it is very Aquarius-like. It's not the Sag part of me. It's the Aquarius part of me that can see that from that broad perspective. I mean, the Sag gives a truth seeking, and then the Pisces keeps the emotion, keeps that humanness, keeps that intuition and depth, and the reason why I love emotion and like talking about it, because it's like it's why I was an actress first, because it's why I love Law of Attraction and Abraham, because let me say it for the 15th million time for anyone that hasn't heard it yet. The only reason why you want what you want is you think you'll feel better when you get it. That's it. That's all you need. So if you get that, it's all about how we feel all the time. Every single moment of every single day is about how you feel.
Yeah.
Every choice you make is about how you feel. And if we don't learn to be comfortable with negative emotion, comfortable in pain, and take it as, like you said, I love that, as an opportunity, as an expansion, as a, what was the other word you used? You said it was potential, as potential. Okay. It's potential. What if you started looking at your pain as potential? Like, that's exciting to look at pain as potential.
It is. I mean, it's extraordinary to hear you say what you've just said, because the reason why this book is alive today is because of patients saying to me, I can't believe that what you've just said actually makes sense. Which was, I used to think, I can't believe that what I've said has made sense. So that's great. That's two of us now. But I think, like you, I do exactly the same thing. I sort of somehow have a gift of being able to bring alive stuff that's very ordinary for me, but it isn't ordinary for other people. Mind you, their worlds, I definitely need teaching about. So, I can't get smug. I'm just very good at my corners of the world and earth. And then when I say to my darling team, who are doing all this technical stuff, they just go, I've literally got, in fact, I'll have to show you. I've been given this. It's a boxing glove, because the boxing glove is taken out if I go anywhere near the technical stuff.
Which is good. That's a wonderful boundary, and right. That's great. Yeah. Do you want to go near it?
No, give me people. Do not give me automated systems that are like making love to an octopus on dry land. Not my deal. No, wow. No.
What an example. Making love to an octopus on dry land. That is a very, very clear thing you just said.
Yeah. No.
Well, Catherine, I want everyone to get your book. I'm going to take your test. I think everyone should take the test. Let me take that back. Let me cancel the should. Cancel the should. You have all the options to do whatever you want. Don't listen to me. If you feel inspired to know more about your seasons, I would encourage you to be curious and take the test. Okay. Yeah. Cause again, back to Dr. Marshall Rosenberg, the most violent word we use is should. So it's a habit. I try to pull it back if I do it. I don't mean it as you don't have no choice, but that's, not a nice thing for me to say. So I take it back, do whatever is right for you. I just encourage that if you definitely want more information about how to use your pain as potential, God, that's so good. Then, this is a great place to start. Get her book and dive in and reach out to her for help if it's something that calls to you. And the book is just chock full of connections and stories and an understanding of these seasons and the elements and the colors and your organs and your symptoms. So you want to dive into that. The pain paradox. Catherine, thank you so much for being here.
It's been a real honor. I would like to do this every day with you. This is enormous fun for me, talking about these wonderful subjects, because most of the time you get this kind of blank look. My emotions are important.
Well, my audience will love you and love this conversation. The rest of I don't know about the rest of the world, but I've attracted those who understand what we're talking about and love it too. So thank you so much for your time.
Thank you.